So this person that is going for interview today at 2 o'clock, I don't know, are you feeling tensed? Have you left the house? Let me know in the comment section. Do you want to come up, or you want me to start teaching here right away while you listen? It is expected that by now you should be ready. Okay, it is expected that by now you should be ready. So whatever I'm telling you now should be a kind of reminder, a kind of revision. Yeah, it should be a kind of revision. You must have been doing something before now. Okay, so as you are going for the position of healthcare assistant, these questions are a kind of, I won't call it mandatory, but you are likely not to skip it. First of all, I have to start with tell us about yourself. Like I said before, when they ask you that question, to tell them about yourself. Where is that? Which one do I use to prepare you in now? Okay, tell us about yourself. When you want to answer that question, please, you need to be brief. What do I mean by being brief? You don't have to start saying everything. Just tell them yourself. My name is Juliana. Um, I'm a graduate of microbiologist. Currently, I am working in a dementia facility where I support the residents with their day-to-day activities, and I've also acquired some skills and training. What skill have you acquired? What training have you acquired? I don't know. I have my MVQ level 3, I have my MVQ level 5. I've also done some trainings and certifications. I've also acquired a lot of skills that have been helping me in doing this job, such as being able to work as a team, being able to communicate effectively and properly, being able to work, being able to have patience. I am a very patient type. It has enabled me to, be able to manage my residents professionally, because sometimes they can push you to the wall, but because of patience, you understand their condition, you understand that this is not them acting. So I understand them because I've got patience, and it have enabled me to calm down, listen to them properly, pay attention, and be able to know what to do. Okay, so this is you. Let me run it down again. It's as if I'm under pressure. So tell us about yourself. Remember, sometimes they can ask you, tell us about yourself and why you think you are fit for this job. Or they can ask you, tell us about yourself and why you want to become a healthcare assistant. Okay, my name is Juliana. I'm a graduate of Nnamdi Azikiwe University, where I studied microbiology. Currently, I am working in a dementia health facility. I don't know where you are working now. Is it nursing home, or are you a domiciliary carer? So whatever thing you are doing, whatever position you have occupied now, whatever thing you are doing, tell them currently this is what you are doing. Okay, and you'll be working there for this period of time. Currently, I am working in a dementia facility for over 2 years, or it depends how long you'll be working there, where you support the residents with their day-to-day activities, where whatever thing you are doing for them, you just put it in summary, like I just said, support them with their day-to-day activities. You tell them what skills and qualifications you've got. I've also acquired a lot of skills and certifications, training such as MVQ level 3. If you have dementia training, whatever, even if it's online training, whatever training that you have done, list like 2 or 3 for them, and tell them that you have also acquired some skills such as good time management, ability to work as a team, because you understand that you must work as a team to be able to be successful in this job. Tell them that you are able to manage your time properly. Tell them that you are able to communicate effectively. Now, I am moving to the next one. I put it together. Tell us about yourself and why you want to become a healthcare assistant, or why you think you are fit for this job. I think I'm fit for this job, or I want to become a healthcare assistant because I love to help people. I love to be the reason people smile. I love to be the reason why the vulnerable adult I care for, who are not able to help themselves, are able to fulfill their task for the day. I love to care for them because I understand without me, they are not able to complete whatever thing they want to do. But because I am there, I am their helper. I am there to support them to become what they want to be. I am there to support them to achieve what they want to achieve for the day. I am happy to be the reason they are happy. So I always like to rush to that part. So you don't diverse. Just let them know that you want to become a healthcare assistant because you are happy to help people. Okay, pick that point. I want to become a support worker because I am happy to help people. I love to safeguard them because I understand they are vulnerable. They need somebody who will safeguard them at all times, somebody who will support them at all times. I love to be that person. Okay, so if you are talking to them, be talking with authority, like it's coming inside of you. I want to, because this is, I love to be the reason they are happy. I love to be the reason they smile. In fact, tell them whenever they look at you and say God bless you, you feel fulfilled. You are fulfilled. Like whenever you see that they are happy that you help them, you feel fulfilled. It makes you feel fulfilled. Caring job is all about taking care of another person, being the reason someone is smiling, being the reason someone is happy. That is all about care. Okay, so it's not too much thing to say there. Okay, they can also ask you, why do you want to work with us? Why do you want to work with us? They can even put it, tell us about yourself and why you want to work with us. Or tell us about yourself and why you think you are fit for this job. Or tell us about yourself and why you want to become a healthcare assistant. So most times they mesh these two questions together. Sometimes they don't. So if we take it one after the other, I have explained, tell us about yourself. The second one, I have explained why you want to become a healthcare assistant. The third one, now I'm about to explain, why do you want to work with us? Why do you want to work in this company? Why do you want to work in this organization? So if you want to answer them, this person that is going for interview at 2, please pay more attention. And for every other person that is preparing for interview, Ashley, hi. Now, please pay much attention. Why do you want to work with our organization? If you have not checked what that company is into now, you can log out now and check. Or if you have second phone, check what that company is into. Where I work is more of dementia care, respite care. Yeah, it is more of dementia and respite. So what are they into? Find out, or check what their goals are. The goal of that company, the goal, some of them, their goal is inclusion, person centered, whatever thing they said their goal is, see if it aligns with your own. So me answering this question, I want to work with your organization because the goals or the services your company or your organization offer is in line with what I love. It is in line with what I want to do. For example, me as a person, I want sometime in the future, in the nearest future, it won't be very long, I want to open a care facility in my country. And this care facility is where residents with dementia will be taken care of. So I want to work with your organization because from the services I read online on your website, you offer services to residents living with dementia. So I want to specialize in this. I want to learn more. As I'm working, I want to learn more on how best to care for them because I have this goal of opening my care facility in my home country in the future. So I want to work with you for a very long time so I can grow in this field and be able to learn better on how to manage them. So there is no employer you will tell this that will not be like she or he have a long-term goal. Like they really want she wants to know more about this. Okay, so if you want to work with an organization, you need to know what that organization is after. Like me, I cannot look for a job in an organization where do not offer services to residents with dementia, people with dementia. If it's nursing home, I am not going there. If it's rehabilitation, I'm not going here. Supported living, no, except if those clients or patients has dementia, because I've developed this type of love for that field. I don't know if you understand. So find out, what do you like as a person? What is it? Nursing home, you can tell. If it's nursing home, you can tell them, because I know in nursing home, I've worked in nursing, they do more of hoisting. In my company, you will do less, about just two people to hoist, just to help them get up and put them in the wheelchair, not that they cannot mobilize. But in nursing home, you see most of them who are bedridden, they don't move, you need to reposition, you need to, in fact, they depend to 100% on the carer. If that is what you love, you can tell them that you want to work in this nursing home because you want to support these vulnerable residents who are not even able to move themselves. You understand that if you don't reposition them, they are like that, they remain where they are, they will develop pressure sore, and you would love them too. I don't know if you understand. Speak from your heart, let them understand that you know what they are doing, you read the services they render, you have experience of what they are doing. Now you are coming to work with them to learn more, to grow in that field. Do you get it now? To grow in that aspect. You get what I'm saying? So I don't know if, please put, like, write in the comment section if you guys have understood. Let me move to the next one, because this guy said, I don't know if it's lady or man, I don't know. He said you have interview at 2 p.m. Yes, okay, so answer it with that. What that organization is running, go now and see what is in their website. If you don't want to do it with the services they offer, look out for their goals. Listen, some company, I could remember the last time I went to Debbie, one of the reasons why I even applied for that job was they wrote in their core values, um inclusion of the smallest unit, or something that, like, they need more of other smaller parts in their company, like they need more of blacks. That is inclusion. And me being the type of person that I love to carry everybody along, so even though I did not get to the interview section, what I will tell them that I applied for this job because I even saw that people of the minority group are respected, are included. So if I'm successful working with you, I will know that I am included. Nobody will exclude me. Do you get the point? So go and find out. If you don't want to do it with the services they offer, find out what their core value are. If their core value also include care, if this person that I'm preparing, do you know their core value? Do you know their services? If you know, put it in the comment section so I can put it together for you on how to use it to answer that question, because I cannot manufacture core value from anywhere now. If care is in their care value, tell them you love to care. You love to care for people because it gives you satisfaction. It gives you maximum fulfillment that, I am the reason this person is happy. I am the reason this person have taken their bath. I'm the reason this person have gone for activity. I'm the reason this person have done this and done that. Yeah. If that is okay, I move to the next one. Yeah, what qualities do you think a healthcare assistant should have? Now this question is also what you are going for, healthcare assistant. If you are going for a support worker position, they can still ask you, what qualities do you think a support, their core value is care. It cannot be only care. List all of them together before you send it, so I can pin it and tell you. It can't be just care. Check. It cannot be just care. So people have like 3, 4, 5 values. Yeah. So what qualities do you think a healthcare assistant should have? Listen, if I'm answering this question, it should also teach you about when they ask you what are your skills, what are your qualities, what qualities do you think you have that qualifies you for this job? Care, dignity, quality, ambition, caring, inclusive, and integrity. Good. I'm coming. Let me go back to this question. Why do you want to work with us? Now, if you want to do it with the care value, you have care, you have dignity, you have quality, you have ambition, you have this person calling me, this is not the right time. You have care, dignity, I will pick care, I will pick dignity, I'll pick inclusive, and I'll pick integrity. You tell them that when you went to their website, you saw the core values, which include care, dignity, quality, inclusion, that is inclusion, and integrity. You tell them, first of all that you are caring, you know, that you are the type of person that love to care, you love to look out for people. So you love to care, you have dignity, and you know how to protect other people's dignity, because you love your own dignity to be protected. You are the type of person that value your dignity more. So you understand how to protect residents' dignity. You understand that if you want to assist them with anything, you have to respect them. You have to respect their choices. Okay? Talking about inclusive, that you're so inclusive, it means that everybody working in this environment is included in what they are doing. Nobody is being excluded. It means that everybody have equal opportunity to grow. It gives you that satisfaction that you can grow in their care, that you can grow from being a carer even to becoming a senior carer, to coming into management, because they include, it is inclusive, they include everybody. Everybody is being carried along. So that inclusiveness gives you that sense of belonging, that if you are successful and you belong to them, working with them, that you understand that they will carry you along in everything. They will give you all the necessary support you need. Put it to them to understand that this is what you are expecting from them. You have what integrity. When you talk about integrity, somebody that maintains a high standard of something, you cannot go below. You tell them that you've got integrity. The way they see you, you cannot lie. It's not that somebody cannot lie, but tell them for things that matters, life is involved, somebody's care is involved, it is person-centered, that there is what we call duty of candor, that you hold duty of candor at a very high place. You cannot say what is not existing, that anything that will make somebody to question your integrity, you do not indulge in that. Okay. So I move on to what qualities do you think a healthcare assistant should have? Now, as a healthcare assistant, no one is listening. People from YouTube, I don't know what. The thing is this, I am on 2 live stream, one on the TikTok, one on YouTube. And my platform on everywhere is all about care. Okay? It is all about care. I am preparing people on how to go for their care interview and pass. These people, they have got experiences, but some of them, due to one thing or the other, they are not able to understand how to put things that they have been doing in words to be able to pass this interview. So it's not like they don't know it. They know. Many of them are carers for a long time, but not everybody have that confidence to speak. So I speak to them to understand that this is what they have been doing and this is how to put it in words. Okay? So that is what we are doing here. Okay? Yeah. Qualities of a healthcare assistant. Number 1, I used to put patient. Patient. Okay? Patient. Tell them that you've got patient, or a healthcare assistant should be patient. Teamwork, being able to work as a team. um what again? Honesty. That is where duty of candor comes in. Accountability, good time management, teachable. When I said teachable, when you work with somebody who is teachable, you can easily tell the person, this is not the right way to do this. You understand? This is not the right way. Please do it this way. And they will take correction and do it the right way. Rather than someone you will tell them this is not the right way, they will argue with you, they will take it up, they will, in the end, it will still backfire. They refuse to learn, or they will go behind the doors to still do the wrong thing. So tell them that you are teachable. You are somebody that can easily adapt, you can easily cope, you can easily change. Tell them that you are flexible, you are not rigid to change, you are not rigid to learning, you are very flexible. Compassion, accountability, I have said, good time management, accurate documentation, good communication. In fact, let me tell you that there's none of them is below each other. But you see good communication skills, team working, good time management, honesty, patience. You see these 5 things. Please, if you are listing your skills or your qualities, do not skip it, except if you don't have it as a person, except if you are faking it. But for somebody to be a healthcare assistant, my sisters and my brother, you must have patience, because your colleagues will push you. The resident or patient you look after will push you to the wall. Your management will push you to the wall. The resident family members will push you to the wall. So if you don't have patience, you might end up doing what you will regret. Even good listening skill, you must have to be a good listener. Good communication. If you are not good with communication, how would you convince the interviewer that you are a good carer? If you are not a good communicator, how would you communicate with the residents for them to understand what you are saying? Because when they are challenging, I'm still coming to that, when the residents are challenging, you will need to communicate to them in a way they will understand. They are crying, let me not go far, because that thing is another set of interview. So when they ask you what qualities do you have as a healthcare assistant, or what skills, when they talk about qualities, skills, strengths, 3 things, all of them are the same. I used to differentiate it when they talk about skills. Skills is something you learn and perfect over time. For example, teaching is a skill. Do you also know that teaching can be a strength? So that's why I used to tell people, do not be confused when they ask you about your skill, your strengths, um, your qualities. Please list as many as you can, because what is a skill to me can be a strength to somebody. Like, a strength is something that is inside of you. Day in, day out, it is inside of you. You don't need to improve it. Even if you don't improve it, it is there. It will not die. But a skill, I'm just trying to differentiate it for you. A skill is something you learn and perfect over time. For example, I say teaching. To me, teaching is my strength. I love to teach. It's wake me up anytime. I can teach anything concerning what I'm saying without looking in the book. All right? But to some people, it is a skill. They learn how to teach, they continue teaching, and over the time they perfected. So if I say that teaching is a skill to me, it could be a strength to another person. So when you go for interview and they ask you about your skill, teaching can be a skill to you, it can also be a strength. The interviewer will not separate it, they will not differentiate it for you. It is you differentiating it for yourself. Okay? So qualities, skills, strength, they are the same. Okay, so your strength can also be honesty. Your strength can be honesty. Your skill can also be honesty. Your strength can also be honesty. I don't know if you guys understand what I'm saying. I can say that being honest has been my source of strength, because whatever happens, I am honest, I am truthful, I come out to say it. And that will be my strength. That will be something that will be your saving grace. Let me put it like that. It could be a weakness to some people. Somebody that is not able to come out to say the truth the way it is a weakness to them. But you that will come out, no matter how bad it is, no matter how hurtful it is, you don't mind. You take responsibility. You are accountable. You come out to say, I have done this, I have done that. This is how it is. So it could be your strength, it could be your it is a quality. You can call it quality, you can call it strength, you can call it skill. There are some people who are not honest, but maybe because they have been working in care over the time and they have learned the importance of being honest, they have no option than to what? To be honest. They will tell you, because I said the truth doesn't mean I'm going to jail, therefore I will be honest, I will tell you the way it is. Those people, sometimes if you take them off that environment, they are likely to go back to their old self, because it is not in them, it is not their strength, it is not their quality. I hope I've made that very clear. So when you talk about qualities, skills, strength, you can talk about good communication, teamwork, good documentation, good time management, honesty, accountability, teachable. I've explained what being teachable means: flexibility, compassion, patience, and whatever thing you feel that is your strength. They can ask you something. It just come to my mind. What do you think you are bringing to this team? What are you bringing to the team? When I went for interview, far back, when the manager asked me, what, apart from all you think is your strength and your skill, what extra thing do you think you are bringing to the team? I just said to him, I am able to work as a team. I know I have good time management, I've got patience, but something extraordinary may be funny to him. He said what? I said, I am a good dancer. So he was a kind of confused. What does dancing got to do with the job? I said, because sometimes the activity coordinator, is not with the resident 247. It is me, the carer, that is with them 247. So I dance with them, I make them feel happy. When I dance with them, they are not bored. They are not looking for where to bank. I just make a cup of tea or coffee for them. We sing together, we dance, their mobility is being improved, they are engaged, they are active. And the man was like, in fact, I sometimes I used to say, maybe that was why I got that job. Or maybe this was the first time the man was hearing something like this. Okay, so find that thing you think is not. I am a good dancer, not like professional dancer, and I can also sing. I even got an album. But you see my residents, we sing a lot. They don't joke with Kia, Sarah, who can sing it like 20 times. I don't get tired, they don't get tired. We sing, we dance. We use some musical instruments. We beat on the table just to engage them and make them happy. I think that was what got me that job then. Because when he asks, what extra thing do you think apart from your strength? So if they ask you this question, think about something you might think is funny. I used to tell people, that thing you think is funny is nothing. It can actually bring you something good. Because when he asked me, what extra thing, what do you think you are bringing? I said to him, I'm able to work as a team. I'm a good communicator. I am teachable, I'm flexible. But this is for the resident. I am a good dancer and I sing. He was like, how? Like how? He don't even understand how such can relate to the job. I said, most times or sometimes the activity coordinator is not with the resident 247. Even sometimes they go on leave, I am the carer with them from 8 to 8. So at some point in time during the day, they are tired, they are weak, they are bored because they are doing nothing. I make cup of tea for them or coffee, depending on what they like. We will start singing, we will start dancing, small small, moving our body, our hands, singing. Some of them are banging on the table, we are doing it. Mobility improved. They are engaged, they are active, they are happy. There will be no room for them to be agitated. There will be no room for them to be challenging. There will be no room for them to be confused because they are engaged. So please find out something extra and hold it just in case they ask. You can borrow mine if you want. And please make sure you are doing it, because this is something in me. I do it without anybody asking me to do it. Okay? So the next one I have here is, describe a time you provided excellent care to a resident. I got that question a lot of time when someone was asking me what is excellent care. Excellent care means providing high quality care to a resident. When you talk about high quality care, a care that is timely, a care that have effective communication, a care that collaborates, a care that works as a team is an effective care, is an excellent care. Take for example, you go to attend to a resident and they are not letting you do nothing. What do? You have to communicate. You have to collaborate. If you communicate and it's not working, you have to collaborate with your colleague. You can't do it alone. And that is you also working as a team. So I have some example here. I have that there was a time I found out one of my residents was finding it difficult to eat. Okay? And I observed this resident. At some point, we'll find out maybe he was not enjoying the food, or he don't like the food. So I observed this resident. I communicate with the resident. I asked the resident why they are not eating, and from the response I got, I found out the spoon they were using was very. They are not able to lift it. When they age, sometimes they don't do some things you feel they can do. And when I found out the spoon was the problem and the cup was the problem, because the fluid intake was poor, the food intake was poor. But when I found out the cup was the problem, she's not able to raise the glass cup, and I found out the iron spoon was the problem. Is it iron, or what do they call it? No, the normal spoon we use. I suggested a plastic spoon and a plastic cup. Okay, plastic spoon and plastic cup was offered, and there was changes. The nutrition improved, the fluid intake improved. This is me giving excellent care. You can also tell them about a time, you went to offer personal care to a resident, they were refusing. You left them, you come back later, you explain to them the need because they are incontinent of or whatever. The condition you found them is not nice, you cannot leave them. So you offer them what they like, you communicate with them, you took your time, and after some time they were able to give in and get showered or whatever. So excellent care, it means you giving when you want to give a care, it was becoming hard. What did you do in between to get that job done? You communicate. Like I said, an excellent care is a care that involves effective communication, good collaboration, team working, and the timely. Because sometimes when you waste a lot of time to come back, or when you did not give enough time and go back, it will not work. Do you get what I mean? You ask somebody, do you want to have shower? They said no, they were shouting. You left. You were supposed to maybe go back in 10 minutes or 15 minutes, but you went back in 2 minutes again. They will still remember they said no. Or you were supposed to go back in 10 or 15 minutes, you went back 3 hours later. It will be as if they just went back to bed, or you just woke them up from sleep. So it have to be timely. You have to time them properly. You have to communicate with others. If it's not working for you, remember, you must not do it. You must not. Others can do it. If they are not letting you, let another person do it. Okay. Yeah. What are your weaknesses? If they ask you about your weakness, I used to tell people, do not say something that is critical to the job, like saying you find it difficult to tell the truth when something goes wrong because you're always scared. They will not take you. They will not take you. You tell them that you don't come to work early. You always sleep off, and sometimes you wake up at 9 and get to work at 10, and that has been your weakness. They will not take you. Do not say something that is critical to the job. Or you tell them that you are not a thief, but sometimes if you see gold or diamond, that you hardly leave it. So you don't steal, but when you walk past something, the thing get lost so long you like it. They will not take you. Do not say something that is critical to the job, please. So I used to say my weakness is not being able to work in a toxic environment. And whatever weakness you tell them, please try and make sure you let them see that you are working towards overcoming your weakness. Because when you tell them about your weakness, they will also have to help you to see how you will come out of it. Or if anything goes wrong tomorrow, you can still refer it back to, like me. I am not able to function in a toxic society, in a toxic environment. Let me use a smaller distance, in a toxic environment. So if I try my best and it's not working, I can go back to my manager to say, remember, during my interview I told you I am not able to function in a toxic environment, and I've tried my best, it's not working out. I think I should walk away. I'm giving you example. So you can always refer back to what you said during your interview. So you don't need to say something that is critical. Tell them, telling them that you don't steal, but if you see a resident diamond, you can do something. They will not take you because resident, they have got money, they have got a lot of things. Okay, they will not take you. So what is your weakness? Tell them how you improve it. What is your salary expectation? They can ask you. Can we relate the weakness of that to that of mental support? Mental support. Do you know that being kind to the fault is a weakness for this mental? Do you know that being kind, telling somebody that you are kind to fault, it makes people take advantage of you? That you are very kind, it makes people to take advantage. That you can sacrifice your time for somebody, it makes people take advantage of you. You tell them that you're honestly working towards it, to know when to say no. Sometimes you find it difficult to say no. Okay, yeah, it could be someone's weakness. Sometimes you find it difficult to say no. It can be your break time and somebody will plead with you that they need to get it, they need that. Sometimes you sacrifice your time for other people, and sometimes it doesn't end well with you, but you are kind to fault. It is, yes, is a weakness. You can even, some people's weakness is even well, there was one lady that said that her weakness was, did I note it that day? Yes, that her weakness was doing a lot of things at the same time, and in the end she don't know, she won't come to conclusion. Like, she find it sometimes that she's struggling on, she used to struggle on how to prioritize her task. Prioritizing task is an interview question, but now it is, she knows how to prioritize her task, but when she gets to the field, prioritizing task becomes her problem, because she will want to do everything without disturbing others. But this job is all about teamwork. You can't do everything. So she said her weakness is doing everything at the same time, and in the end, she will not arrive at any conclusion. So what she normally do now is that she will get her paper and list out all she needed to do for the day, and she will be taking it one after the other. So she passed her interview, but that was what she said. So it can be a weakness. It is a weakness. A lot of people do not know when to stop. They do not know when to seek for help. Rather, they will be doing the job. I call them assiduous staff. They want to finish everything by themselves. It's not working like that. Care job is a continuous something. You can't do everything. What is your salary expectation? I could remember then, When I was new in this country, they asked me what is my salary. I said 15,000. That was very poor. So please check, go back and check where you applied for that job. See what they put there as the money they want to pay. So when they ask you, you don't say something way too below or something that is way too above. So it should be um something reasonable. Most jobs they attach how much they want to pay. So say amount that is reasonable. What are your long-term goal? So in this long-term goal, you have to show them how ambitious you are to grow in healthcare. You know, your aspirations and whatever. So they will know the type of training they will put you. I don't know about other companies, but my company, because of like what I said, it is open that I want to own a care facility back in my country. Why? Because the knowledge of dementia, we don't have it back home. We don't have it back home. So they still treat people with dementia as if they are wish. They call them wish, they call them wizard, they call them evil, because they've lost their memory. They say a lot of things. Even they think they see people that have died. And back home they see them as evil. They'll be like, if you have not done evil, how will you be seeing bad people? They'll be saying a lot of things for them to confess and all that. So they don't have that knowledge at all. In the village they don't have it. Okay, so my long-term goal is to open a care facility where these people will be taken care of. So working in a dementia facility, assessing people before bringing them in the dementia facility, give me that knowledge to know that this person have got dementia. They lack capacity to take care of themselves. So I need to bring them in the facility to care for them. All right, this is my long-term goal. I don't know what your long-term goal is. Okay, so what is your long-term goal in the healthcare facility? It could also be that your long-term goal is to grow into the management level. I also want to grow into the management level up to a point that I'll be going for check in different homes, just like CQC. Because if I get to that level tomorrow, when I go to homes, I won't pay attention to the manager. No, I rather pay attention to the carers, because they are the one in contact with the resident. They are the one that will give you the right information you need before you get to the manager. Okay, why? Because I have worked as a carer. I know what it entails. So going forward, moving forward, if I come for check, I know things to look out for. There was a time we had a supervision and they said, no, the carers, they don't wash their hands. If at all they are washing their hands, they must be doing it elsewhere. Why? Because the person that came for that supervision have worked as a carer. So she knows if this sink is in constant use, it should look a certain way. Do you get my point? So you can tell them you want to grow to become a manager tomorrow, you want to grow in the care field to become CQC member, you want to grow to become a nurse. You can even tell them that you want to become a nurse in the nearest future. Okay, so and this is being a carer is your starting point. You can, whatever your long-term goal is, if you want to borrow mine, make it real. What are your availabilities and preferred working hours? This type of question, please be honest. Please be honest. Because if you know for any reason you have got child care, that you've got a child to care for, and you don't have a partner, or your partner cannot, cannot take care of the baby on a certain day, tell them that on Tuesday, Sunday, I must have to stay at home because I have a child to care for. But Monday, Wednesday, Thursday, Friday, you are available to work. Okay? So you have to tell them so that they will know that you have something that will make you not to work in a certain day. If there is nothing, tell them that you are flexible, you are free to work any day. Don't say, I cannot work on Sunday because I'm going to church. You cannot get the job. I am sorry. Healthcare job is a humanitarian job. So you can't say, I cannot work on Sunday because I'm going to church. That is not happening. Um, how do you prioritize your task? I have said it before. Tell us how you prioritize your task at work. When you talk about prioritizing tasks, it is all about doing the first thing first. Tell them that you do what you should do first. Tell them, for example, if you have a resident who needs to go for hospital appointment in the morning, and you have a resident who you just need to offer personal care and bring them out from their room, that you will first of all attend to that person that will go to the hospital, because they will have to leave the care facility for hospital appointment before going to the other person that is not going anywhere. So you prioritize your task by doing the first thing first. you know Matter of urgency, which one should come first? Should they take medication first? Should they have their breakfast first? What should they do first? So you do first thing first. You come in the morning, you have a resident who is incontinent of feces and urine, they are soaking wet. You've got a resident who is sitting in the dining room, they just want breakfast, and you got a resident who is in bed sleeping. Who would you attend to first? You have to attend to that one that is incontinent. That one that is soaking wet, you have to attend to them first. Then you give the one that is in the dining room waiting for breakfast before going to the one that is sleeping to ask them if they are ready to come out from the bed. So this is you doing it according to the way it should. You cannot leave who is soaking wet and who is sitting in the dining to go and wake somebody up. Maybe if you go to wake that person, by the time you will come back, you don't know, maybe that the other person in the dining needs to have something. Do you get it? So you do the first thing first. I just give you example. That is how to answer the question. How do you prioritize your task? I prioritize my task by making list of what I should do, by doing the first thing first. You can give them example. I always give example when they ask me. I always give example. For example, if I come to work in the morning and I have a resident who is soaking wet in bed, we call it being incontinent. Yeah, incontinent, soaking incontinent of urine or feces in bed, and I've got someone who is still sleeping. I won't leave that person that is soaking wet in bed to the one that is sleeping, because that one is at risk of pressure ulcer. That one is at risk of skin breaking. So I have to get them out from there first, then before going to the other person. I hope this simple illustration helped. How do you maintain confidentiality? When you talk about confidentiality, it is all about keeping patient or resident information safe, making sure you do not share their information to somebody who shouldn't have access to that. So maintaining confidentiality is all about protecting the resident's information from getting into the hands of unauthorized person, from getting into the hands of somebody who should not have it. Your security, maybe we don't have gate man here. The cleaner shouldn't have access to what a patient or a client. You don't have access to that information because you are a cleaner. You don't have anything to do with the client. Your duty is domestic, so they shouldn't know that your client is suffering from this or they are suffering from that. A resident family that visited shouldn't know that your client or your resident is going through this or going through that. They shouldn't have access to that. Okay, so you shouldn't share their information to who should not have it. You are only allowed to share their information. When I mean information, it includes their name, their date of birth, their medical condition, the medication they are taking, everything about them. You shouldn't share it with who do not need to have it. That is what it means, maintaining confidentiality. Wait. How can they say that my life is inactive? How? Who? Please, oh. How? But I can see people liking, I can see comments. How can they say that this life will end? It is inactive. I should put something in the middle. How? Please, oh, guys. Type in the comment section, send gifts, put yes, anything to make Please, because I don't know, how long have you stayed? Is it on this life? I've stayed uh I've stayed for like 45 minutes now. Please type type something, send a request if you want to come up. um I don't know, anything you can do to make the life active, because I don't know why. Oh, they are not tapping. Okay, please tap. Please tap. TikTok is funny. Please tap if you can. We have 86 people here. There is no way this life is not active. Tap if you can. Send gift if you can. Type something in the comment section if you can. Anything. Who is young here?
Alpha.
Okay, yeah. I've done that. So that is it. That is confidentiality. I hope that is understood. The next one, how do you ensure patient's dignity and respect? Karen, you want to ask question?
Hello, nice to be here, Chino. So, if that is your name, sorry if I pronounced it well.
Yeah.
I think you should just go on because I'm really enjoying your class. Let's just take down our questions. Then later we can ask you our questions. Is that okay?
Yeah, it's fine.
Okay.
I'm
Thank you
just
so much.
trying
I
to
really
run
enjoy your
through
section. It's
because
nice to be here.
you're welcome. I'm just trying to run through because someone is going for interview at 2 p.m.
Yeah. Okay, please let's just concentrate. I also have questions. I'll write them down when you're done. I can ask
Okay.
because I wouldn't want to interrupt you.
Karen, are you the one going for the interview?
Yes, I'm the one going for the interview.
Oh yeah, ask question if you.
Yeah. I will ask you when you're done. I'm still putting down my questions aside so I don't interrupt the class.
Okay. How do you ensure patient dignity and respect? When we talk about dignity, you tell them that you make sure dignity is, in my language you call it nkwanye ugwu. Okay, how do you respect? It's all about respect. You make sure you don't shout at them. How do you do it? I make sure I don't shout at them. I speak to them with respect. Do not be scared to mention that respect again, because it is what it is. I speak to them with respect. Karen, please leave home on time to go. Okay, maybe it's close. She knows. Thank you, Jenny, so much. Thank you for your concern. I make sure I speak to them with respect. I don't shout at them. I make sure I don't abuse them with abuse of any kind. I make sure that if I want to enter their room, now I'm going to the main thing. If I want to enter their room, I make sure I knock on their door before I enter into their room and get their permission to come in. Before I assist them with anything, I make sure I let them understand what I want to do for them, the service I want to give to them. I make sure I let them know that this is what I want to do for them. I seek for consent and I get the permission. I don't force them. I make sure I don't force them to do. Ushenna, thank you. I make sure I don't force them to do anything. I make sure that if I want to give them shower, the doors are closed, the windows, the blind are closed, so that just like me, if I am in the, this is me answering the question. I'm not just talking. No, if I'm in the bedroom having my shower, I make sure that I lock everywhere so that my dignity is protected. I would do the same for them. That is how I respect them. If they need privacy, I make sure I prepare everything they need to have their shower. Let them do it in discreet while I stay and wait for them. Okay, I make sure I involve them. This is you. The question is, how do you ensure patient's dignity and respect? Remember, This question can be asked in different ways: protect their dignity, respect their dignity, ensure their dignity and respect. So these things I'm mentioning are ways to do it. When you hear dignity and respect, how do you give it to them? How do you make sure they have it? How do you make sure it is protected? I don't shout at them. I make sure I speak to them with respect in a calm manner. I make sure I listen to them. I pay attention to what they want to say. I make sure I communicate to them accordingly. Before I go into their room, I make sure I knock on their door to 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 let them know that I'm coming in. I make sure that I seek for their consent, whatever thing I want to do for them. And when you go to hospital, yes, politely, when you go to hospital, they want to, so for someone that have been pregnant before, that gel they used to put on your body for scan, they will first of all tell you that they want to put gel. It's not gonna hurt you, it will be a bit cold, so you will know that what they want to put on you will be a bit cold, so you will feel it. Not when they will put it you panic. Shey you get? So this is them involving you in what they want to do for you, communicating with you. So you will do the same. That is what you do for the resident. You let them know what you want to do for them. These things are not difficult. Are you happy to have a shower? They will say yes or no. If they say yes, you get everything ready. You open their wardrobe. Do you want to wear this? Do you have any clothes in mind, any dress in mind you want to put on? I don't mind. You still tell them this one is okay. They will tell you fine. Just getting them involved in their care, it is also a way of protecting, respecting, and ensuring their dignity and respect. Um, what again? I don't even know. To be honest, I didn't know the page of this paper that I opened. A lot are in this paper. Okay, this one is for support workers. Support worker. Tell us about yourself. Why do you want to work with us? What is your understanding about safeguarding? Another important thing I don't want to miss. Talking about safeguarding. Safeguarding is all about protecting the vulnerable people you care for from all sort of abuse, harm, and neglect. Protecting them from anything that will cause them harm. In fact, anything that will make them to feel uncomfortable. Protecting them from all those things. You didn't complete the amount you put as your pay. The amount you put should not be something way above what they put during the advert, and it shouldn't be something very low, because remember, some people can be, do you know, in a company some people are getting £13, some are getting £12, some are getting £11 something. It is still the same job title. So that's why I said, go back to where you did the application, go and see how much they attach for that job. See how much they attach, so you will say something reasonable. If what they put there is 28,000, if what they put there is 28,000, you can tell them that you are expecting nothing less than, from 28 and above, or nothing less than 30,000.
Please, can I ask a question?
1 minute, 1 minute. So talking about this, 1 minute, because somebody is going for interview. I need to run down so she can ask her question and leave. Okay? Safeguarding is all about protecting them from all forms of abuse, harm, and neglect. Do not stop them, my sister. Go forward to tell them that residents can be abused in different types. Okay, there are physical abuse, that you are not allowed to beat them, hit them, kick them. It is not allowed. That is physical abuse. You are not allowed to shout at them, call them names. You are not allowed to do that, because that is an abuse. Sometimes they classify it as emotional, sometimes they classify it as physical abuse. You don't necessarily need to classify it for them, except if they ask you to tell them different types of abuse. You can tell them financial abuse, physical abuse, emotional abuse, um physical, psychological abuse, neglect. Okay, when you talk about financial abuses, anything that has to do with their finances, their money, their jewelries, anything that has to do with their finances, you shouldn't take it. If you take it, that is financial. You are stealing from them. You are exploiting them. Okay, when you talk about emotional abuse, calling them names, trying to checkmate them with their fellow resident or patient. Like when you tell a resident, look at you, you can't even go to toilet, you are messing everywhere up, this person can go to, are you not seeing this person, those type of demeaning words. That is, it is affecting them. They might not have that courage again to come out to the dining, because the person you are checkmating them with, you are comparing them with, it could be that the bladder have failed him or her. It may be that they are not intentionally doing it. Before they could get to the toilet, they're already wet. Maybe you are frustrated, you are tired, you have changed them 6 7 times before. So you don't call them names. That is emotional abuse. Physical abuse, you don't hit them, you don't bite them, you don't kick them. That is physical. Talking about um what again? I don't remember. If you remember, put it under the comment section. Neglect. When you talk about neglect, is a form of abuse, a situation whereby you don't give food, you don't give water, you don't offer nothing. Yes, you asked to do something for them, but they refuse. You never went back. You left the person unkept, clothes not changed, incontinent, food, no water. That is neglect. The person is sick, you did not call the GP, you did not inform the doctor. That is neglect. You were supposed to give the person medication, they are refusing, you did not report it, you did not try again. That is neglect. Yeah. How do you ensure the vulnerable adults in your care are being protected from abuse? How do you ensure that? Is by observing them, keeping an eye, communicating with them, giving them listening ear, removing anything that will cause them to fall, removing anything that will expose them more to harm. Can you provide example how you have implemented? What would you do if you suspect that a client or a resident is being abused? Once you suspect that, report, document. That is it. If you suspect that a resident is being abused, you have to report, you have to document. Discuss those examples. What examples, my dear? What examples are you talking about? Martins of Grace, what example are you talking about? Those examples are new ways interviewers use to decide the outcome. Okay.
Yeah, they will give you a scenario, or they will ask you to give an instance or give a scenario where make they will just not discuss this, just defining the concept. They might want you to apply, or we bringing up a scenario.
Okay.
To apply
Oh yeah.
safeguarding issues or things like that. That's what I meant.
Oh
Sorry.
yeah. I'm still coming down to that. I even put it as a different question. I put it as a different question. So what he was saying is, when they ask you about safeguarding, like I used to say, do not end at saying it is all about protecting the resident from all forms of abuse, harm, and neglect. Go further to explain. Go further to explain. Go further to explain. If you witness an abuse, please report, document, and follow up. Once you witness an abuse, report, document, and follow up. What again? Karen, please ask your question. Maybe it will help us. I'm just rushing because you are going for this interview. If once you leave, we'll go back to normal.
Thank you very much for your teaching so far. Like, thank you so much for your attention. Though I've been able to do some
Karen, Karen, 1 minute. Karen, 1 minute. Do not forget this question because you are likely not to skip it. Tell us about a time you went above and beyond to help a resident or a patient. Tell us about a time you went out of your way to help a resident. Tell us about a time you did something extraordinary for a resident. Tell us about a time you did something that made a resident smile. All these are the same question. You know, if you watched any of my video before now, there was where I talked about using STAR method to answer question. That STAR method will warrant you to tell question, to tell a story. So if they come up with tell us about a time, please, you will need to tell them a story. Okay? Yeah. So what they want to check with that thing is to find out if you have the initiative to know when to give help, extra hand. This extra hand is not in the care plan. This extra hand is not in line, is not in the plan of what you have to do for the day. But it's still that extra hand or extra care, it must not be against the care plan. It still must not go against the standard. Okay, so it is still something that is within. You can tell some things like, you got a resident have a winter jacket. Now we are going into winter. They have a winter jacket they love so much. One of the buttons are no longer there, or that the zip spoiled. The family provided another one, but they love that jacket so much because it has so many compartments. So they like to put tissue here, they want to put this here. You want to save a lot of things in that jacket. So they keep on wanting to wear that one. You communicated with your manager that you can actually fix that zip because you have experience on how to sew clothes. You have experience on how to do it. In fact, you have the equipment on how to do it. He allowed you to do it. You brought zip and you put it for the resident. When you gave it to the resident, they were so happy. They prayed for you. They were very, very happy. This is you going out of your way to put a smile on their face. You going out of your way to do something extraordinary. You going out of your way to you do it, going above and beyond to do something for a resident. I also have experience where one of my residents have refused to take medication. The problem is that he wants to go to the park. Okay? And you communicated with the resident. If you take your medication during my break time, I will take you to the park. They accepted. During your break time, you took them to the park. They enjoyed themselves and they came back. This is you going out of your way to do something extraordinary. Remember, it's your break time. Okay? You have a resident who loves to they love to paint something. So one of her friend birthday is coming up and they want to paint a card. They want to design a card for them. They don't have the materials. You've got some of them. Or you went to the mall, you bought the one you can and you gave it to the resident to be able to draw what they want to do for their friend. Okay, and they were very happy. So this few example, it just came to my mind. When a time you went above and beyond, a time you did something extraordinary, a time you did something to put smile on their face. How do you manage disagreement between the resident families and the carers? How do you manage disagreement between you and the resident? How do you manage disagreement between you and your colleague? That question is testing your problem solving skills. It's testing your listening ability. People are not tapping anymore. They are asking me to put some. Your life is inactive. Why? Okay, so they want to know your problem solving ability. Let them know that you will communicate with everybody. so they will feel respected. You respect their opinion. Tell them that you will help them to come to a conclusion. Okay, tell them that you will communicate, you will listen, and you will bring suggestion. Okay, Karen, go on.
Yeah, I just wanted to ask if you can help me throw more light on three question I have here.
On.
And I have three questions here for you, so you can just help me and throw more light on them, please.
Yeah, okay.
Um, the first one here is, please, can you throw more light on person-centered care? What does it mean to, like, what does it consist about person-centered care in general?
Person-centered care is all about giving care, the type of care that resident or that patient wants. That is the simplest way you can something is for. I'm Juliana. My name is Juliana. Juliana centered care. The only thing that I want, that is, in fact, the care plan is the centered care. So the care you give me according to what I want, according to my care plan, according to what I want. For example, you come in the morning, you want to wake me up, and I said I am not ready to come off the bed. Okay? But you needed me to come off the bed. But because what you are practicing is person-centered care, you will not drag me out of the bed. Because when you do, you have violated that. What you will do is to let me stay in bed and come back later. And I said, please make sure you wake me up at 9 a.m. It is person-centered care that you go to that person at 9 a.m. Like giving a care that is in line or according to the care plan, according to what that patient wants. So because resident A wants to go to bed at 9, that does not mean that resident B cannot go to bed at 7 if they so wish, or to go to bed at 12 a.m. if they so wish. So providing care according to how that patient wants it is what is called person-centered care. What that exactly tailored down, that specific thing they want is, I don't know if you get it now.
Yeah, yeah.
That is what it means. So you
And the
give care
second one,
according to how they want it. The care you give, like you now, you are going for, what I'm doing for you now is person-centered care.
they
Because
just
you are
okay.
going for interview at 2. I have to leave every other thing, like going deeper into some other thing, to run it down in a way that if you can grab something, it will help you during the interview. What I'm doing is person-centered care. But if I leave it now to start asking Hope, say something, Praise, say something, Damilola, say something, it is no longer person-centered. It is no longer focused on you.
Okay.
Understand?
Yeah. Okay. The second one, and record keeping is important. How do you answer that kind of question?
Say
Because
that
sometimes
again.
I really don't know how to put my words together to answer it.
Say that again.
Like, what do you think documentation and record keeping are very important? The importance of record keeping and documentation.
Okay. Oh, 1 minute. I think my student school is calling. Hello?
Yeah, how are you?
Good.
Can you hear me?
Yes.
I need you to tell me.
I am busy, very, very busy.
Okay, no wahala, no wahala.
Later.
Alright, bye.
Record
Is
keeping. Can you?
important. Yeah,
Sorry,
we can hear you
sorry.
now.
Call came in. Somebody called me. Record keeping and documentation the same. It is very important for so many reasons. That question is the last question I have here. Put the question again so I will answer it in an interview mode.
The importance of documentation
Good.
and record keeping.
Documentation is important because one, it helps to keep track of care.
Okay.
Giving to the resident. It helps to keep tracks, record of care given to the resident. When you keep tracks of care given to the resident, it will help to either to improve, improvement of care, to know what next to do. For example, you went to give a resident personal care, they refuse. Another person tried, they refuse. You keep on recording it, you keep on recording, you keep on recording. You give medication, they refuse, you keep on recording. After some time, the GP may say, if you are giving them medication to drink like tablets and they are refusing, and this medication is important, they do not have the capacity, maybe we need to change it to a liquid one. Now they have to put it in the drink. If you are not recording all those things that they are refusing, how would they know that they need to change what they were doing? So it helps to keep track of record. It helps to keep track of the care given to the resident for improvement, for change, for anything they need to do. Another reason for you need to record is for, how do I put it now? How do I put it in one word for you to understand? Record keeping will help you to keep track of services or track of care you give to the resident. Record keeping will help the management to know how best to manage a resident, how best to care for them. Record keeping will help the carers to know how best to care for this person, because if you try one way and you record that way is not um working, we will try another way. So if there is no record that we have tried this and it's not working, how do we know that we have to try another thing? Apart from being, you're not a legal document, yes, apart from being legal, you covering your own back, because record keeping is more of resident centered. It is not, you are meant to record everything you are doing because it will cover your back. You are giving fluid, this person is not taking it, eventually they landed in the hospital. Let me tell you, Karen, if they ask you this question, this is what you say. Tell them that record keeping is important because it helps to keep track of care given to the resident. Tell them, for example, I have had the experience where a resident, we used to offer fluid, he will refuse, he will not drink, until one day they were very sick, taken to the hospital. They said that this resident is dehydrated, that we don't give them fluid. We were able to prove that we give them food from the recordings of all the carers. It is always recorded that we offer this and that. We offer drink, we offer water, we offer orange juice, we offer squash, we offer everything. But this resident will not take it. So the doctors were able to believe us. The safeguarding they raised or whatever thing they have said, we were able to prove that we have been offering and they are not taking because we were documenting it. Did that answer the question?
Yeah.
Let me quickly chip in my own question, please. It could also
Question.
help.
Is it question or answer?
Question.
No, wait for Karen to finish, please.
Karen, I would also like to chip in just to help. You can use word like, if it is not recorded, then it is assumed it is not done. It never happened.
Yes.
So if I'm being asked that question, that's what I just said, and it ends there. Because sometimes you can say too much thing and also get yourself in trouble. Yeah. So to avoid so many words, just said, I believe that record keeping is very important to healthcare. And one of my strategies to record keeping is that if it's not recorded, then it's never happened. Yeah.
So the last one I have here is how to deal with compliance.
With
residents, relatives compliant when it comes to you about their relative that's in the care home.
Yeah. When they come to complain, what we do is to listen to them. After listening to them, we tell them that we have heard what they said. We will have to inform the management about their complaint, and the management will surely do something. It's not up to you to do It's not up to you. What your duty there is to listen to them, document what they have said, and communicate with the management.
Okay. Thank you very much for the answers, though. Thank you so much.
You're welcome. Good luck.
Thank
Please
you,
let me know. Let me follow you.
Karen, don't go. Karen, don't go because my question could as well get a tip.
Okay.
Question I'm going to ask. So there is this carer who was making TikTok videos on the resident's home, in the private residence. So, and then he make these TikTok videos. He goes into the bedroom, one of the bedrooms. He make one video. He's on the lounge. He makes another one. He's on his front room. He making another one. In the kitchen. He make another one. Right at the backyard. He make one, and then he keep posting these videos on TikTok, and people were watching those videos. So one day, one of the, I would say, a close family friend of this resident, saw, went on TikTok. Of course, the algorithm pushes these things randomly. And so I don't know how she came about that one. She watched that video. And she was able to recognize some specific places in the house, some wall pictures hanging, some cupboards, some stuffs that are quite personal to there are some of the in this because it's a 3-bedroom house. So he called the attention of the man, and then the man said, okay, there's no problem, that he doesn't really mind about that. Now, whether or not he is minding it at this point, is it right for a service user? Yeah, because the question I was asking is he not breaking his privacy? Is he not breaching his privacy?
Confidentiality.
His privacy, because that's his private space. He hasn't got any other space to himself except that his house. And is this right for a carer to do? If yes, is this a safeguarding? That's the question I wanted to ask, and I believe the person going for interview can pick something out of that.
Okay. In that sense, if the person I'm caring for in his or her home does not mind where I make my video, if I am allowed, what does the company policy say? Am I, number one, am I allowed to use phone at work? If I'm allowed to use phone at work, it's even insane, it's stupid making videos in your client's house. But let's keep that aside. Am I allowed to use phone at work? If I'm allowed to use phone at work, is there any specific places I'm not allowed to use the phone? If no, and the person I am caring for does not mind if I record or not, there is no problem. Who will raise the problem?
Remember, family members, for the gentleman who owns the home, he hasn't given any consent. In fact, he didn't even know. Somebody brought it to his attention.
Understand what I'm saying? When they brought it to, he said he don't mind. You make comment said safeguarding. Who will raise the issue? Nobody. But in a case whereby the man found out and he was angry, he will raise, of course. And when he raises it, the carer will be in trouble. But if the person in question does not care, and maybe the resident family raise it up, and the person he or she is caring for have got capacity, it will be a problem when this person do not have capacity. If the person have got capacity, yes, and you take this lady to court, the person he is caring for will tell court, I have no problem with her making her video. If that is what is making her happy to care for me, I don't have problem with that. But it becomes a problem or safeguarding when the table turns round. But the big question is, are you allowed to use phone at work? That is the big question. Are you allowed to use phone at work?
My question is not about the man what I'm saying, is it right for someone, a carer, to go into a client's house and record himself dancing or doing stuff and post on social? I'm just asking, is it right?
I just said before that is insane. because I as a person will not do that. I have my home to do my recordings. Okay? And that is why I said, what does the company policy say? Are you allowed to use phone at work? If you're not allowed to use phone at work, why would you go with your phone? Your phone should be in the bag until it's closed.
Okay,
So it's
this is
not right. You shouldn't do it.
It's a different care setting. It's a class A. It's a living care arrangement where
Yes.
you live in the client's home. So going in and coming is not the issue. It's now living in that house. So
No,
sometimes at
it
night,
is an
sometimes
issue.
in the
It
day.
is an issue because I have done live-in care 3 times and I ran. That live-in care, there are places you are not allowed to record. That is why I made mention of, is there places they are not allowed to record? Not that they cannot take call, but there are places you cannot place your camera. Okay, a normal person who is sane cannot be recording something that will put him or her in trouble. But even if they record, as you said, is a living carer, even if they record and the person they are caring for have got that capacity to even see them, they are recording. Do you know that some client comes into their carers video? Do you know? There are some carers, they go there, the family don't you see, the family do not mind. All they are after is, if this is what makes our mom happy, please let them do it. So in that case, who will come and raise the concern? Is it the company? If the company do it, it is person-centered. The family will say, we don't mind, that no case. When it becomes a case is when the table turns. But the big question I keep asking is, are you allowed to use phone? Are you allowed to record? If it's not against your company policy, as per the type of job you do, then there is no concern. But if the table turns, that is the big problem. I don't know if I answered you. Or your question, is it right to record? Is that what you are asking? Is it right to record? I am not in the position to determine if it is right or wrong. The company policy, the contract she signed will determine if it's right or wrong, and the person they are caring for. But I, as a person, I cannot go into my client's house to record. I cannot do that. Because tomorrow somebody can wake up and say, I am not aware, I didn't give consent, I didn't know you were doing this, and they will use it against me. But you have people who do not care. Okay? They do not care. I have somebody, the client and the carer is like son and father. The family, they have already taken the carer as even their father's personal carer. They do TikTok videos, they do everything. Even they have YouTube channel. Yeah, I'm being honest with you. The family do not mind. They see it as, this thing is making our father live long. Because the father is not even vulnerable, he have the capacity. I don't know if you understand. Even if the person, somebody said, if the person is vulnerable and the family give consent, remember, when someone is vulnerable and something is giving them happy, is making them happy, you are not exploiting them, it shouldn't be a problem. But the big question now is, are you allowed to do that? If you are not allowed to do that, then you shouldn't do it. It becomes a problem. I, as a person, I cannot go to a client's house to start recording in the client's house. People in the box, please put mouth in this question. Maybe I'm not answering what he wants to hear. People in the box.
I think with the issue of this recording or no recording, so you said it all. In fact, I'm beginning to ask if you are CQC yourself. It all depends on your, what is it called? Your company's policy. You cannot, I know so many care homes do not allow the use of phone. But for people who go into living care, you can't tell me that I'll stay in someone's, I'll be working for a whole 1 week and not use my phone. You still need to respect your company's policy in regards to how you use your phone, even as a living carer. Some companies don't mind using your phone, but they will tell you some areas where your phones are not allowed. Well, you can use your phone during break time in the staff room, but not when you're caring for a resident in their rooms. That is breaching client confidentiality. What did you? Yeah, it's also breaching confidentiality because you're exposing them, and also it's a form of abuse. Do you get? So you just need to work with what your company's policy says about phone. I am very, very sure every care company, they have a policy in regards to the use of phone. No, they don't joke with that. So they have a policy. So just read what your policy says and do it. And if you choose to go the other way and do what you feel you want to do, disregarding your company's policy, then it's all left to you.
Martin, okay, sorry. Yeah.
I don't think there is any company that will allow you to use your phones. I don't think
the same thing I said. People that do live in care.
They need to be care. It means the matter is delicate and that person needs your undivided attention. If not, the person would have domiciliary carers. But for you to live in care, it means that the person needs undivided attention. So you going to your phone, creating content, posting it.
No. Posting content no. That's not what we are talking about the use of phone in general, not creating content about That's not.
Depends on what the person said. That the person makes videos and posts and all. For you to have such a time, that means 3 hours of your work time.
I'm only talking generally about the use of phone. Maybe picking phone calls or just replying messages. I'm not the content that will pass my level.
Do you know that you can be on your break, you raise your phone and make a video of yourself and post on your social media?
If I'm on my break, I use the staff room. I don't use where my clients.
Do you get? Do not attach emotions to, when it comes to judgment, your emotion does not matter. What you feel does not matter.
It's what is right.
If it's not, it is the fact. It is the law. If a client, this person have created over 10 videos in a client house, and you see, Martin, if this is personal something, I don't put mouth. I won't engage in it. If you're asking these questions and it's directed to a person, you will not get the right answer. I am speaking to you now in general. But coming back to what you said, that this client does not consent to it, that means she started doing it on her own. And this client does not consent to it. And when they found out, they persecute her or they want to raise safeguarding against her. They are right. Why? Because she didn't ask. She was not given permission to do so. She started doing it on her own. It is just like you in a care home going into a resident room and eating from their food. Nobody have asked you to do that. The manager is not there to catch you until the day they will finally catch you. Okay? If it's written, if the family have said carers are free, like I've got a resident, the family will come put a very big sweet chocolate and they will make it clear to us, feel free to eat. That is different. Okay? Now, she started doing that. The family is not aware. And when they found out, they said to her, we don't mind, feel free. If that is making you okay and making the person you are looking out for is making them happy, feel free. You can even record. Both of you can do your videos if that is making him happy. There is no case. Even you, Martins, you have no case. Nobody, there is no case. Do you get it? If I have a childminder and he's always making videos with my son, I don't mind. If that is what is keeping them together at all times, is making him knows where this person is. I don't mind though. Maybe 2 of you will become celebrity. I don't care. Okay? But if I don't want my son to be on social media, then I will stop you. And if I stop you and you don't stop, I will take it up. I don't know if you understand. So
okay, can I give a little bit more background?
No, this is personal now. It's not a general something. I'm not gonna take it. It is personal now. Except if you want to tell us a story and tell us how everything has ended.
Well, I'm asking. I came in. I took up my shift yesterday, and this thing started coming to me. It's like I was a bit confused. I didn't really know how to answer them or respond to it. The person who left,
Tell
I
them to
was
follow the company policy.
Yeah, this individual now doesn't, is just an agency. When there are shifts available and nobody to
They
cover,
will
they go
stop
and look
booking
for
the
the
person.
agency to bring them in. So I was just trying to find out. But well, generally, from all that you have said here, I think the bottom line is it's not actually right. It
It's
doesn't matter
not.
how, whether company allows it or whether, as long as that individual hasn't given you any written
Any
consent.
consent, yes,
As
that
long
is
as you
what
don't
I've
have
been
any
saying.
consent that is written down, not verbal consent, I don't think anybody, any carer any who is in his right senses should go to somebody's home and then we are making videos and we are putting on TikTok, we are dancing in his own home, only for him to see it on on a family member's account where he was scrolling through them. He felt a little bit embarrassed, even though he said no problem. But I mean, on the right, with the ethics of the job, I mean, in the right senses, carers need to obtain consent, no matter how, because they're actually violating the person's dignity and privacy. Remember, these people are vulnerable. So you might think, yes, they have consent, they have capacity, but remember, they are also elderly and vulnerable people who might not always be there, to understand everything, that the impact of those videos, because these videos we are counting 10, above 10. So I don't think it's the right thing anyway.
Have you
That's what
have
I
you
wanted
seen
to ask.
have you also seen on, I'm not supporting the carer that did what she did. Like I said, every company have got their policy. If your company found out this and it is against their policy, they will never book him or her again. If the family want to take it up, they will prosecute her. Okay? But like you said, that if somebody said if a resident have got capacity, he will not have a living carer. That is not true. Remember, you can have capacity for one thing and lack capacity for another thing. You will have residents who have capacity to tell you their name, what they want to eat, what they want to wear, what they want to go, but they will not have capacity to decide if they want to take medication or not, if they need to go for surgery or not. So you might have capacity in one thing and you lack capacity in another thing. Just like we that is normal, we feel we don't have dementia. I might have capacity in care. I have no capacity in politics. I lack capacity there. So I will need help. If I want to go into, I will need somebody 247 there. Okay, so if the family have not consented to you to come and record in their homes, a normal person who have their sense intact will not do that at the first place. Understand me? They will not, they will wait when they get home, they will do it. Okay, or if for any reason they want to make any video at all, you shouldn't be exposing your client's house. At least have a spot. Sometimes I make record when I'm at work if I'm on break, but because of some reason, just like something you just, I said to myself, do you know it can be used against me? Somebody can come up one day and say, oh, she's making videos when she was supposed to do this and that. How do I prove that I was on break? Did I post that video immediately? I recorded it. Some videos I record, I posted 1 month after. So you people, if you are wise, you don't intentionally set yourself up. Anything that will, even sometimes, if I want to make video on my uniform, maybe I will be in my car. I can't be in my car if I'm not on break. And if I should leave the facility to my car, the CCTV will capture me. So if you bring up a case against me tomorrow, there should be evidence. And my company have not have a policy that you shouldn't make video with your uniform. No. The policy is, do not put something that will put the image of the company in danger. Do you understand? So what does the company say? You are talking of violation of privacy and dignity. Is also a breach. I agree. I agree. I am not saying no, but what I'm saying is this. What from the first background you gave us, you said somebody goes for a shift, they are making videos and posting it, a family member saw it, they reported to the person he is caring for, the person he was caring for said he don't mind, What do I think? Is it right? That was the first background you gave us. And I said to you, listen, if the person they are caring for do not have any problem with that, what does the company policy say? Are you allowed to use your phone at work? What does the company policy say? That was the question I asked. Are you allowed to use phone? What does the company policy says? If these two things are balanced, what does the client says? If they said no case, who is gonna take it up? Is it you, Martins, that will take it up? There is no case, but it becomes a case when it is true he did not seek for consent or she did not seek for consent, but for the client saying no, there is no room for that consent anymore. I don't know if you guys are understanding me. If the reason I have said, oh, she's making videos, I don't have any problem with that. You, Martins, you will not come to bring up that because that person that said he or she doesn't mind, you still call them. They say, oh, I know she's making video. I don't have any problem with that. Who will raise that safeguarding? But it becomes a problem when the policy of the company says.
That's not correct. That's not correct. If that person says he doesn't have a problem, you are only limiting it to that individual. What about the broader law around care and vulnerable people? That's just what I wanted to ask. What about the broader law? What about the UK law about privacy, data protection, and all of that? Have you also looked at that?
Who
If
is
the person
that?
say yes,
Oh God!
there is
It
also
takes two people. It takes two people. Get me right. It takes two people to go to court. For you to have a case, it takes two people, right? It takes me and you to go to court. Now, you are talking about something. Yes? Huh? Ano mi na-ekwu? Ọ na-alahụ ụla? Huh? 1 minute. Onye mụ ya? Oriri nri. Mee ya ka ọ lahụ ụla ọfụma. Anọ m na TikTok live. He cannot appear here. Ọ appear here enwe problem. Na-ekwosa ya mmiri, kwụsị ya mmiri biko. He cannot come here. Otherwise, I will have to end the live. Wearing uniform to shop can even be an issue. I just need you people to understand one thing, what I'm saying. This carer that was making video in a resident house is not doing the right thing. Because as a caregiver, I am not allowed. I cannot, me as a person, go to a client's house and start recording, even in the care home. Because you can, somebody face can come in there and they may not like it. And when they see it, you understand me, Presh? When they see it, they can take it up against me. But if I have a company and my company is a living company and I have no policy on use your phone, you can use your phone at work, but maybe I will put something like use it wisely or use it reasonably. Don't use it when the carer needs your help. Don't use it when the resident needs your help. Okay? And I go to a resident family. When maybe the resident is sleeping, maybe the CCTV is there, they have not caught me where the resident is ringing, the client is ringing, I did not answer, the client needs help, I did not answer. There is no case of such. And I'm making my videos. Yeah? Now a family member see it online to say, oh, Papa, do you know that your carer is making videos in your room everywhere she stays? And the Papa said, oh, is it, as they said yes, but there's no problem. You don't have to worry about that. Who will take up the case? I need you to see it in this direction. I've answered your question, but you are talking about the law, the UK law. Who will take it up? Is it right to report this to the company, or should I leave it alone? It is up to you. It's up to you. You know what you want to do. So, and that's why I said at first, I'm not gonna give you that thing you want to hear. Do you get it? Like, you know your company policy, so you should know what to do. But I'm telling you, if a client have said, I don't have any issue with this, there is no case. It takes two people to have a case. So if you take that girl to court and the person he's caring for will say that um vulnerable, I'm talking of somebody that have got capacity. You guys, I think some people are not understanding me. I think some people are not understanding me. If you are caring for somebody who does not have capacity, you are there is no case now. The family member will take you up. If they don't want, they will take you up. If they don't give, they will take it up. Then you will have a case. But if the family member, no problem to them, so long our father or our mother is happy, so long is making our mother, our father happy, no problem. So there is no case. That is what I want Martin to understand. But if the family member is worried about this, and your company policy, it is against it, then what should you do? You report it. Are you guys getting my point? You report it that this is what this carer is doing. The home have reported, or did you speak to the carer? Sometimes before you make some report, speak to the person involved. Listen, they might be doing this without knowing that they are breaching, they are doing something wrong. They might be doing without knowing that, this company I'm coming to work, this thing is against this company. They might not know. Did you speak to this person? Or you want to report them because you heard it from the family member? Did you speak to them? Did you tell them, listen, this thing is going on, I've heard about it, can you please stop? It is against the company policy. You don't do this. The person we are caring for is vulnerable. They don't have the capacity. If they come up tomorrow, they can use it against you. Please do not do this again. If possible, delete those videos. If the videos have not shown any face of the client and they wish they do not want to delete, or did you speak to the person? You need to speak to them. But if you feel you don't want to speak to them, you want to report them, then you can go ahead and report. It is up to you. What does your company policy says? Did you read your company policy? What does it say on the use of phone and social media with the client? What does it say? I think I've hammered more on that topic. Okay, somebody wants to come up.
Please, Chino, so I asked a question about the six C's of care. Are you going to talk about it today?
I am not guaranteeing that, but I will give you a follow if you want a teaching about that. Then I will work on it and I will post it tomorrow.
Okay.
Even though I already had a video about it, a detailed video about it, I can still forward it to you to listen.
Yeah, please, thank you. I would appreciate that.
Yeah. Adakibeya, exactly, my sister. This is what I've been saying. Me as a person, or many of us here, wouldn't do that. We wouldn't do that. I even use myself as an example. The time I used to make video, maybe during my break time in the staff room, I make my video. But somebody can wake up tomorrow and say, yes, she was making video. She was supposed to do this. She was not there. That was why this person had a fall. How do I prove that I was on my break? So for that reason, I've got a connuch, I have sense. I have to stop. Martins, I don't know if I have answered your question, my dear. Let me give Martins a follow. Everybody on the box, let me give them a follow.
Hello, Chinonso.
Hello. Hack pause, it's been a long time now. No, hack pause. This man here, I know him before.
Chinonso, can I go on?
Yes.
I have someone, a friend, and she'll be going for police interview under caution. I don't know if you have any idea about that.
Going for what?
Police interview under caution.
Police interview. I'm care. I'm doing care. I don't know anything about police. So. I don't know anything about. Let them go on YouTube now. It will.
Yeah.
All right.
I personally think that this whole stuff, or some persons,
What is it now?
companies have their do's and don'ts. And most people that do videos, I think most of them do it out of ignorance. Because I know someone that, though ignorance is not an excuse, I know someone that lost her job because she made a WhatsApp story. So her colleagues viewed her story and screenshotted the stuff. She was with a resident and screenshotted the story and sent it straight to the manager on WhatsApp. And she lost her job. And when she was asked, she said that she didn't know it was a problem. She thought it was only a problem or it would have been a problem if she posted it on Facebook, TikTok, that she saw WhatsApp as a safe place. And that was why she just did the story, knowing that she knows that the story will disappear within 24 hours. But known to her, this thing I'm telling you happened just 2 weeks ago. Unknown to her, her friend, a colleague also viewed her story, screenshotted it, and sent it straight to the manager. She lost her job.
Before we continue, go to your WhatsApp stories and do the needful. Go there and do the needful.
Don't even save their numbers.
Go there and do the needful.
We don't understand that our employers look at our status, they look at our social media account, they look at what we put there, if it's have anything relating to us or anything. I just want to help the sister that was asking a question about police interview. From the little I know, I think there is a case. Because of course, everything is a criminal case to them. So I think there is a case somewhere that might be a safeguarding. An investigation is underway. So what I would recommend you to do to that kind of interview is, if that person has a lawyer, please go with your lawyer. Don't go alone. I'm begging you, out of the what I know, don't tell that person not to go that. If the person can hire a lawyer for maybe for that 1 or 2 hours of that interview that is going to last, because then themselves they are gathering evidence from that interview. Remember, for a legal action. And you might end that these kind of things will definitely go into what they call PNC, Police National Computer, either by caution, either by whatever outcome, depending on what they have decided. So it's about a potential offense. I don't know the background, but I'm just telling you, it's just to gather evidences to now approach the law court, now to prosecute that individual. So what I would rather say here is just see if it is possible. Get one lawyer to accompany you to that interview. The lawyer will tell you whether or not you need to say anything, because the lawyer will be more informed about areas about legal issues. Normally, they will say remain silent. You have the right to remain silent. But remaining silent without clearing yourself or without trying to explain out your circumstances very well can also jeopardize your chances when you remain silent. And again, when you are talking, you can also talk, you can also shoot yourself on the leg by talk. That's why I say here we know how to take questions, how to give responses, and how to conclude matters on things like that. That's what I wanted to say on that one. Thank you.
Thank you so much.
Thank you very much. Because she's in Unison, and Unison gave her a solicitor, so she'll be going with a solicitor. Yes.
Anything that will make us get to this level, please.
Doctor,
do like this 3 times.
Unison will accompany them. I think they will do a good job for her.
Do like this 3 times. Anything that will make you do like this 3 times. The end well. No. Ordinary disciplinary, the end well. Do like this. Help us.
My dear, it's not that everybody. I think everybody has his or her own challenges in his or her workplace. You understand? Just our prayers is just that that God should always give us a victory. You understand, and escape routes, because those people, they are very very mean. Most especially we immigrants. Honestly,
Yes, but we too, we do too much. I'm
Honest.
telling you, sister.
Hack boss B, let's hear you. God's favorite is okay.
Yeah, I think the suggestion Martin gave in terms of that is valid. But the fact that Unison is providing the criminal.
Yeah, thank you for having me.
Adakibia, how do you know my mind? I don't want to say do you know that your manager may be the union lead? Help us, let's hear your voice, Bikonna.
No, I said the fact that Unison is providing the form of a solicitor to support them, that's good because police interview under caution is not something anyone should approach ignorantly because there's a likelihood of you compromising yourself. But if you have the legal backing to provide that support, then it's fine. Then also, I think you've covered on the main topic, right? I think you've covered everything nicely because
Thank you.
at the end of the day, right, the use of mobile phones, social media, and the workplace is one that sometimes I think the way people sort of interpret policies, right? Sometimes there are certain things that are not necessarily covered in policies in its entirety, because that can also be capitalized when building a case against an individual in the workplace, so it's always best for one not to expose themselves in a way that will put you into trouble. You understand? Because like every other person I've been touching, if a case is being built against you, right, what they will do, right, they'll do what is called a timeline, where they will sort of like put together instances where, okay, yes, you've used your mobile phone, you've sort of created content whilst at work and stuff like that to ensure that an airtight case is built against that individual. So sometimes the thing that you think might not amount to something serious,
You can't eat on my life.
will always, because one thing you need to understand, right? The employer has the knife and at the same time attempts to get yam. So they fit decide to cut them however they see fit. You understand? So the smallest thing that you think is not of great significance can easily put somebody in trouble. So I think you as the host, you've covered the topic nicely, as well as others who have sort of contributed. You understand? So in terms of what Martin is asking, right? I think you also touched that nicely in the sense that if Martin feels that there's a persistent breach, right? If you feel comfortable speaking to the individual involved, then you can have a conversation to like probably educate them about what they're doing that is not right, And also, right, if you feel that, okay, maybe you've sort of documented the instances where those breaches are taking place, right, then, the onus is on you to make that judgment call to probably flag that with management, but there's no right or wrong in this kind of issue, but the bottom line is just do right by you to avoid any trouble.
Sister Chinon, so you have actually answered it. But my question to this, my brother, is the issue I have now is the family is complaining to me now.
You need
and I
to
know,
listen.
Wait now, I'm coming, just wait. Me now that they have told me, and this my brother, he's my Nigerian brother. I just don't want anybody to misunderstand me. if I talk to him, he will likely not. He will not reason me. He will not reason my matter. And I don't want to create enemy with him over that issue. And I'm also afraid of going to our team manager. Because he will also say, oh, he reported me or something. No, I'm just in a dilemma. Yes, I'm listening.
Martin, listen. In care job, nobody is your brother. The reason I said God's favorite wait was she made mention of Nigerians. That's why I said God's favorite is okay. Listen, good or bad can be black or white. This thing you feel is your Nigerian brother. A white person is doing it somewhere. And you see, law, there is no law meant for the blacks alone and for the whites alone. This is the law of their country. This is the law in care. During your interview section, they used to, even when I was preparing that girl, okay, I didn't say that part. How do you settle this? I said, how do you settle disagreement between you and your colleague, between you and your clients, family members, and all that? Communication. You have listened to them. They have complained to you. Communication. You need to communicate with your colleague. You need to communicate. You need to tell, bro, listen. This family member have complained to me about this. And this same thing is against our company policy. Please, I am advising you to quit from doing this. Please, I am advising you not to do this anymore. Okay? It's not that, it doesn't matter, his agency have sent him to come and work for another agency. So when you go to another agency, you have to behave. You have to behave. Because if you think something that is not against your agency will not haunt you, if it is against that agency you are working for, then you are lying. Okay, so you have to communicate with this person and let the person know that this family is not comfortable. Because if one of the family members is not comfortable but the client is comfortable, they can convince that person to say, listen, we don't want this. They can take it up and silence that one. Okay, so you have to speak to this your brother friend. Let them know that what they are doing is against the company policy and they have to stop. Okay, then you have to put it in writing to let your company know that the family member have complained this. I have speak to him. You have to state it. They have complained this and you have also speak to him about it. So you shouldn't care if they continue booking him or her. Because you are an agency staff. You do not have the common sense to know that you shouldn't do this. And this is not a permanent shift. A lot of people out there are looking for jobs. So if you keep quiet, now I am telling you that thing you want to hear. If you keep quiet, you could also jeopardize your own job because it means you are aware. And when they told you, what did you do? Did you do anything? Did you let the company know about it? No. And you know this is against the policy of the company. That's why I asked at the initial stage, I said, what was the company policy? If the company policy is against what this person is doing, and this person is an agency, and this family knows you as the permanent staff, the other person is an agency, and they have complained to you, and you understand that the vulnerable person you care for does not have the capacity to give consent to do or not. In fact, you are not comfortable with the whole thing. If I'm you, what I would do is to speak to this person. If I speak to him, I will have to hear what he's saying. Whether he say what is right or not, that is not the problem. Then I will have to document it. Even if you don't want to make it official complaint, let it be documented. Let it be documented. that at least you will have a document, an evidence that you have spoken to this person about the concern of this family, and this is what your advice is. In fact, if you want to make it official, you have to put it in writing and let your management know about it. You are not the one booking shifts. If they still want to book shifts for him, it's not your concern. If they want to stop booking him, it is not your concern. But from what you have explained, you are trying to compromise, so it will look as if you don't want to be the reason they stop booking him. But did you speak to him? What did he say? Now you are also concerned that if you speak to him, he will start feeling like you are putting eye in his matter, when you know that your job is also at risk. Because the family member can come up with, okay, you are not doing it with him, then why did you keep quiet when we complained? And your company will fault you that you kept quiet, and you know that this thing this person is doing is not right. So if you are feeling very uncomfortable, and this is agency staff, you need to secure your job. I am pretty sure that that agency staff was not the person that brought you in this country. He was not the person that went for that interview and get the job. So anything that will jeopardize your job, you shouldn't let it happen. I think I am telling you what you need to hear, and this is the right thing to do. If at this point you've not spoken to that person, then you are getting it wrong. And if at this point you have not put anything down to document it, then you are wrong. It is up to you if you want to report it official or not. And this is the last thing I would say on this. If any other person wants to add anything, we are open to learn. So if you are an agency staff here, just know that you are serving two masters. Two masters. The first master is your agency. The other master is that place they sent you. Because if they did not pay you, your agency will not eat. An agency will never want to have problem from where they are eating. Because agencies are eating, companies are eating because you are working. So I wouldn't know why somebody would not have that wisdom to know what to do. You can make videos on the street in your home. Why doing it in the resident home? Why doing it in the resident home?
Okay, thank you very much. Madam. Yeah. Can I say something?
Yes, you can say something.
When there is time, please.
Okay, I think this is just on a general note, not just because of these very others concerns. Part of what makes most of friends actually stay out of point.
Is it Gabriel that is talking and I muted him? Oh, I'm sorry, I didn't know. But
Yes, Gabriel.
noise was coming from your background.
Okay. Can you hear me now?
Yes.
Okay, I was saying that part of reasons, this is just on a general note, not just because of our brother's concern for his friend and colleague. And it's also a point that I would want us to consider learning, not just because of our place of work and also in life in general. A lot of people get scared of telling their friends, family members, some bitter truth.
Especially
the ones that will save them because of their reactions. You know, oftentimes when we take the fear of people's reaction from spelling out the truth to their mind, to their faces, we end up causing them more harm than, being scared of what they will say and how they will react. Some also don't do the same thing. Sorry, I'm in a bus. I think that's why the noise is a bit more. So some also don't say the same things to their family members and friends because for some selfish interest, I don't want to lose my friendship with this person. if I should tell this person this very thing, if there is something I'm benefiting from him or her, this person will cut it away from me. And then we hide the truth from them, waiting for the worst to happen. Like I wrote in the comment section, a good friend is one who will say to you, I told you about this very thing, but you wouldn't listen to me, than one who will say, I was going to tell you, or I wanted telling you about this, and that. So you said the whole thing actually the way it should be said. Our brother in question, summon courage, except if you yourself, you are also guilty of the same thing.
Thank you.
Except if you yourself, you are also guilty of the
Maybe
same thing.
he's making his own video but not posting it.
Yeah.
I think I said
it.
it. You're not allowed on this video.
And you now know that if you report this very person, or if you speak to this very person, he will turn around and say, because this happened in my own place of work, not in care actually.
Even Price said it under the comment section. Sometimes the person you are concerned can snitch. Turn the table around you.
Yeah, so that happened also in my own place of work, where two brothers were Nigerians, most unfortunately, our brothers from Nigerians. They were covering themselves in their dirty stuffs, and then when it was a moment of sharing formula, and it didn't go down well with the other. And that one, that's okay. I'm going to report you because you are the head. I won't be touched because I am just a member. I'm just a staff. And then he went ahead to report the other very one, and two of them ended up being sacked.
Okay.
So except if you're guilty of that, if you are not, my brother, help that brother.
If you are guilty, Martins, if you are guilty, let me tell you what to do. If you are guilty, tell the person. Tell the person. No, don't chat. Don't chat. Do not establish that evidence. No, please.
Okay.
Let me tell everybody now. Let me tell everybody now. Let me tell everybody.
That's just all I have to add. Thank you.
Thank you, Gabriel. Let me tell everybody. If you don't want to establish an evidence, better do not chat. Do not even call. Call the person. Like both of you are working. Brother, please come. We used to do video, but listen, you used to do and post. Me, I will just record if I want to. I leave it on my phone. A family member have complained though. They showed me your TikTok or whatever, and they are not happy. Please, let us stop from today. If possible, go and delete that one you have. Go and delete that one, because if they download it and use it as evidence, you don't know what the outcome would be. Please, let us not do it again. Even the one I have on my phone, I have deleted it. That is if you are as guilty as him. But if you are not,
no, Sister Gabriel, Brother Gabriel and Sister Chinonso, I'm not guilty.
Good.
If you can go to my platform, you will also see.
No. I said you may, and be leaving it in your phone.
The thing is, this my brother. I call him my brother because we both come from Nigeria. The only problem I have with him, because in the past I have an experience with him where he said, where I made a suggestion, something like, I have to bring this out because this one, I know if
this is urgency. Let me tell you, this person is urgency.
Me, no, when did you start doing this job? I've been in this country because he has settled status. I've done this job for so number of years. Which day did you come here? You can't tell me anything. You can't teach me my work. So don't tell me. So,
but that is more reason you have to be smart.
I agree cold. When next I come, I see anything, I no longer have the courage to approach him because of the actions or because that thing make me and I won't get issue. I had to go and apologize to him.
Then such person, you are leaving such person up to this.
He's been in this country. He has more experience. I just wanted to give him his respect. I don't want to argue.
No, you are the one setting yourself up. You are setting yourself up. Even him having settlement should be a threat to you in this condition. It should be a threat. Let's say you are on sponsorship with that company, and him have settlement. That should be a threat to you. So you should, whether he listens to you or not, you should, in fact, find a way to say, bro, the family members complained about the TikTok they find on the video they find on your TikTok. They notice you are doing it in their house and they are not happy. You shouldn't talk to him as if you are seeking for his opinion, for him to say to you, to give you answer. No, a kind of just drop it for him to know that you are aware. Bro, stop, please stop. And you walk away. You shouldn't give room for him to say to you, I have settlement or not. Him having settlement oh my goodness, he should even know better than you, because he has settlement as he claimed. But you know, not everybody, it's not how far, it's how well. Yeah, so him having settlement should even be a threat to you to know that you should act fast. You should put it down in document. If you remember the date the family complained, put it down in, document it and let the company know about it, because that person is a threat to you. Is a big threat to you if you don't know. Gabriel, send request again. Is a threat to you if you don't know.
I think the most important thing here, right, is for you to approach this sensitively. You understand? By sensitively, right, you need to have approach him and have a discussion with him just to flag the concerns the family have raised. Because you know why? Whether you like it or not, right, they've brought that concern to you. And if
As
you
the
don't do
permanent
anything about
staff.
it,
As the permanent.
you understand? If anything goes wrong, right, you are you're kind of aware of that information and you didn't do anything about it. You understand? And that could catch up with you. So it's up to you to decide the best way to approach it. For me, I think the first instance would be to speak to the brother sensitively. Settle status or no settle status shouldn't come into the equation, because at the end of the day, right, if any action were to take place, right, they will not judge the action based on one status. You understand? And you might be the one to be more vulnerable in the sense that if, God forbid, see you go enter trouble, now you go probably they look for sponsorship, whereas the person when gets settled status go there out of job, you go fit claim benefit. You understand? So don't allow that deter you.
Don't allow
Just
that
do
to
right by
happen to
you
you.
and by the system, because at the end of the day, you have to look out for yourself. You know, I know why I'm saying this, because these things, when you think that you are not the one in the wrong, the fact that that information is with you now and you don't do anything, you could be found wanted for not acting upon it.
Don't come to my video. Go.
Okay. And then came from Martin.
Mama, I've been following you for a long time, though I've not been showing up. I love the way you handle the thing of a special work, all these things. So when I joined this thing, they are talking about agency. I stood on. That's why I tried to come in. See, one of the things I want to talk, especially for the staff. When they are the staff, they have agency there. Many things they just allow it for the agency, forgetting that they are the main staff that will answer the question. The agency can work and leave, but you are the main. They don't want to work. They always go and do this, go and do this, go and do this. They don't think whether they are the agency, they need strength, or they don't even follow up to join to do those things. Because they are started, they are just been appointed. They don't want to work. Before some agency will come to take a video or whatsoever, you have to know, because you are working with that agency. You are working. There are some things that they will not do without you. They will just allow the agency. They sit down and turn patron. We call it patron. They give you authority. You take it over. Too much. That's what I'm saying. I'm an agency. I've been working for agency for almost 7 years in UK. I know all what the staff they are doing. So when something happen about agency, if the agency go to talk, they'll win the staff. So before you even go to complain, work out yourself. To me, where it is, you should just keep quiet, go back, say that you don't know anything about that, what happened, you don't know, just apologize and let it slide. To me, what I'm saying, I'm just giving an advice for what I know. Because they allow things for agency,
They see that when you see they started saying that I have my document, I have the means that there are many things that they can say openly. I'm just giving this little advice. I didn't want to come here, but because I saw this, my sister, every time I have a good mind for the people. It advise, even when you want to enter support, it give you advice how you can apply, how you can do this. That's what he's been there. I've been following her, what she's saying for long. Anytime he's speaking, I always love it. The way he answer question, the way he speak, the way he open up, I love it. But I want to let you know, what has happened has happened. Just pray, ask God for mercy, and continue your job quietly. Forget about the man you are for job. When you go to work, when the agency send a man, work your work and leave. Me, I go to work. I don't go work to put I don't go work to control. I work and I like agency and nobody can take it. If you want to give, there was a day I worked until a staff. I was taking care of one staff. It's a white, yeah. They are there laughing, they are sitting, laughing to watch me to go and work. Why they just sat until immediately I used that resident take me almost 45 to 1 hour because that man is too slow to walk to do. They have to take that. They are afraid to shower that man. Anytime I'm there, I'll help to shower that man. So that they sat quietly waiting for me. When I came out, he said, I want you to go to Kama. I do this. I said, I'm not going anywhere. He started until when the nurse came, I just tell the nurse that I just finished on pram. I want to put on the note. This lady, and I need to go my break. He started saying, go to Kama. I didn't tell them that they were there sitting, but I just tried to put my note. He didn't even allow me to put note for what I've done. He's sending me for. Otherwise, that is why I didn't want to go. You see, I just said, the nurse just said, okay, it's okay. I said, I tell the lady that they want me. I said, go, I'm coming. I finished put my note. I joined the lady. We did the work. The thing is that after I need to go there, the next, now that lady was on that floor. They changed me now from that floor, put me upstairs, which there were no work there. Allow her, that nurse said that no, I should not walk. He tell the management that me and that girl after. Now I was not the one who reported. So one staff tell me to open her. I said, no, let me see it herself. I'm not going up. So there are some things that the staff, please, when you are working, take care of your job very well. Take care for your job very well. That's all.
Okay. I think, sorry, ma. I think this our case is different from that your own experience. In his own case, he is the main permanent staff here.
Thank you,
and the person he's talking about is working from the agency. Yes, there are people who prefer to work through the agency because they'll control the shift they want to go to, especially when they have options. Most of the people that accept any kind of job are those who are still under sponsorship. And that very guy, you can see, he has a bragging right that he has his own papers or he's permanent in the country. So he has experience and nobody should tell him what to do. What we are saying here is to save our own brother's head, because if that guy by any means is caught, he will implicate this very guy now who is not saying anything to him because he is the permanent staff in this very scenario. And in addition to what I've just said, my brother, another way you can do this if you're listening, if you don't want to approach it because of the way he responds to you, my brother, put the whole thing on writing, okay? Put it on writing. And when you're done writing it as a note to him, not to your company, you cannot write to him, let it be like a letter, and then point out what you have noticed that he's doing, especially the complaint that the family has given to you. Write it and just like an advice, brother, stop this because this will implicate you and possibly get me involved. And then maybe have a picture of that note and then give it to him. Let him read when you are not there. If after reading it and he approaches you, and then you will know how to respond to him. Just explain more that you don't mean any harm and you wouldn't want it to be affected. And then, just like Madam said, put it down on your note. You don't mention his name, but just note that there is a complaint from the family that one of the staff is this, that, dash. You will not mention his name. It is not left for the company, be their own company. So if they want to investigate it further, so now look, even watch you properly to know if you are the one, watch someone else that is doing that. At that moment, even if the guy is caught, you won't be blamed for any reason.
Mama, for now, I can advise her.
I will say something, please. I will say something. I will say that with my own little experience, in this care, and this I've done care for the past 3 years now, agency and permanent staff, and I mean I've come across this kind of scenario. I will advise him, if there's a way he can stop working with that guy and let somebody else go and try him, because if he reports, they will always mention his name. They will always mention, and somebody will tell that guy that this was the person that reported you. I know if it's Nigeria to Nigeria, it's going to put it into a big problem. So I would advise him, if there's a way he can say he doesn't want to work with that guy, or he allows some, because I've been in this kind of scenario that something like this, that I just have to try and withdraw myself from working with that person, because that person almost put me in a big trouble. So what did I do? I just tried to corner myself. I went to the senior. I said, please, I don't want to work with this person. I keep telling everybody, please, don't put me with this person. Don't put me with this person. If he can, try and say he doesn't want to work with that person again. That's just my own opinion. So that his hands are clean. When the guy is in trouble, he will not be the one to be blamed, because if he reports, they are going to blame him. All the blame is going to come back to him. The way these people are. All the blames are going to come back to him. That somebody is going to tell that guy that this person reported him, no matter how the secret is. Somebody will tell. So that's just my own opinion. Thank you. Thank you, Chino. So I appreciate.
You're welcome. Thank you so much.
Thank you, Mama. I will be going down, but truly, let that guy don't involve anything with that guy. True, I'm just telling by the grace of God. Don't even write, don't even confront it. Silence it like that. You don't know. Let it be. One day they'll caught him by their self. Somebody else will report him, not you. Let it pass like that. It's your friend. Let it be your friend, and like that. Please.
I don't buy that idea. You won't say he don't know, because the family member have raised that concern.
Okay, they bring it to the...
Yes. They have raised that. When you were talking at some point, it was as if you were going off the topic. But I grabbed... Hold on, Ade. It was as if you were going off the topic we are discussing about. But that off you went is a good point. You made mention of permanent staff sitting down and letting the agency do the job, which at some point, if there is a case, the agency tends to win. Because they will have to say a lot of things against the permanent staff. He's not doing this thing, he was sitting down, I was doing this, I was doing that, only me that was doing it. So yeah, I also want to talk on that part. I know people used to do it, and agency staffs used to capitalize on that. I catch one on TikTok live and the know if it.
How they want to kill me? They die very, very fast. 30%.
Okay, sometimes they capitalize on that to say, you see agency staff going to report the permanent, and in some cases you see agency staff being recruited to replace the permanent. It does happen. You see agency staff being accepted more than the permanent staff. And I will tell you something, if I happens to be a manager and I found out that agency staff is more productive than the permanent I have, I will find a way to discard you, and I will take that agency. It happens. So that is a good point. It's not that agency will not do their job. They will do their job, but do not sit down and be commanding them to do it. I used to see people saying they are taking more the more money, the agency paid them more, the agency charge more, so they should do the job. No. people that have worked with me, when they come, I think there was one girl that came to my company one day and said, I know you used to do okay, I'm coming to work with you today. I was just smiling. I didn't say anything to her. I didn't say a word to the girl, because this person have known me before she come here. I didn't say a word to her. But when we started working, we work as normal. You have your list of people to attend to. I have mine. If you need any help, you let me know. But you will see some people, they will sit down. Oh, go and do this. Oh, go and do that. Oh, go. At the end, you frustrate the agency. You stress them out. You take them as if they are nothing, because you think they are taking the whole money. And if other staff have noticed that this agency is working so hard, you know, we give testimonies. Permanent staff here knows. We give testimony. Be like, please book that particular agency. She's hardworking. She's this one. You can imagine that same particular agency will now go to management to report that you did this, you do that, you do that, and they kept on coming and they kept on coming. If there is any trouble one day, safeguarding, if they get rid of you, they are taking that agency. I am being honest with you. So in the case of this Martin, my brother, will have said everything that everybody can say to you. What I said will not override what Hackpos B. I don't know if I'm getting it right. You won't override what every other person have said. What Gabriel have said to you, Presh have said something, Shefomi have said something. It is left for you to use your brain. For me, if I got agency staff that have threatened me with such thing to say, I've got my permanent, I've been here for a long time. Somebody said that to me on my blue app to say that, how long have you been in this country? You are sounding as if you have known it. Or at first, I read that comment as if this person was coming to attack me. And I said to him, does the number of years, does it count with the amount of the quantity of wisdom or exposure somebody should have? Like, because I've not been 10 years in the UK, I shouldn't know the laws, I shouldn't know my rights, I shouldn't improve in my field. Is that what you are trying to say? And the man now said, from your rest, that my comment was, he said his comment was provocative, but the way you attended the comment, the way I responded to him, shows that
sometimes they want to like, they feel just like you, they overlook things. They don't overlook plenty things. What I do now? She be wrong. They basically open mouth. Tell my manager, I said, now me make a leg cut, into cut. The manager, it was even on phone that the manager called me. And me, I was even trying to say, He said, no, it's not you. I'll tell him it's not you. Now what? If not blessing, it go.
You see, this one is at work. You see, she's at work and she mistakenly opened her mic. Is it not this thing that we are talking?
Yes.
Some people get too comfortable at work and they are gossiping. She's at work.
Very wrong.
She's at work and she's on TikTok.
Exactly what we are just discussing.
And this is what we are discussing.
I'm telling you, I don't know what is wrong.
And she mistakenly opened her mic. And what if because I tried to mute her, but I couldn't mute her. What if I left her and she was saying a lot of things and she could be calling names?
Yes.
Why do we like to put ourselves to risk? Why?
It's very wrong.
And now they are talking about a staff.
Gabriel, your network is bad.
Now, I pity the staff they are talking about now. You see, online, everybody online is a saint. If that person have spoken or have said anything to her, don't be surprised the way he or she will sound. Now, look at what is going on behind.
Ask this question, before I ask my question regarding that something you said before. The fact is that there are people who are jealous of people's success, and sometimes it's not because you are blocking their way, but I don't know if it is I don't know if it is if it is built in.
That was how I lost.
Especially those who have this.
That was how I lost the
Especially those who are
67K followers now. That was how I lost it. My previous account, 67. That was how I lost it.
I know, yeah.
They were so
I
jealous.
That time because when you wrote and they didn't respond to you, the thing pained me, like me personally, it pained me because I saw people were making reports against you as if. Now, let me tell you this, madam. Let me tell you this. This is the secret I've discovered. Those people who are attacking you, they are those who have a school where they train people and they charge them money. Now, when you come online, you don't charge people money.
I have never.
Knowledge free. Now, hear me out. I want to know why they are fighting you. You are giving people knowledge free of charge. Why they are collecting money to give people this knowledge? So this is paining them. Are you getting it here?
Yeah.
It's paining them. Now, that is just about that. So you don't have to be bothered about that because you can't change them.
I'm not bothered though.
Okay? Now, I don't know if anybody here have had anybody with that experience. Please, I need an advice on what to do. It's not about my work, but it's about my marriage. I know sometimes it's something that somebody should say. It's not something you should talk about in the public or in the social media. But I don't know if you have seen anybody who is being drawn in the sea. The person cry out with every strength in him or her. That is the stage I am. My partner, I came into the UK with. She's threatening to take my name away from our COS.